Medicare Open Enrollment, what you need to know if you already have Medicare. Today, we're going to talk about big changes that are coming to Medicare in 2025. Open enrollment happens every year and starts on October 15th and ends on December 7th. It's a time when you can make changes to your Medicare plan. You can only choose new Medicare options during open enrollment time, with limited exceptions. In 2025, new benefits resulting from the Inflation Reduction Act, or IRA, go into effect and may change how much you pay for your prescription medications, which means it's very important to review all your Medicare plan options closely during open enrollment. Traditional Medicare compared to Medicare Advantage. Some people have traditional Medicare, which includes Part A, hospital, and Part B, doctor's office coverage, and comes with a red, white, and blue Medicare card. If you have traditional Medicare, you also need a Medicare Part D prescription drug plan to cover the cost of your medicines from the pharmacy. Your Part D plan has its own insurance card that says prescription drug coverage, or Medicare RX. Traditional Medicare requires you to pay 20% of each doctor's visit or service obtained through Medicare Part B. Many people with traditional Medicare buy supplemental Medigap insurance to help cover these costs. Other people have a Medicare Advantage plan, also known as Medicare Part C, which includes a second insurance card in addition to the red, white, and blue Medicare card. Medicare Advantage plans bundle Parts A, B, and usually Part D into one plan. $2,000 out-of-pocket max. Because of the IRA, the most you'll pay for your medicines at the pharmacy in 2025 is $2,000. But it's very important to make sure all your medications are on the list of drugs covered by your Medicare Part D drug plan. Not all Medicare Part D plans cover the same medications. The list of drugs that are covered is called the formulary. Drugs not covered by the plan are not on formulary. If you pay for a medication that is not covered by your prescription drug plan or not on formulary, that payment will not count toward the $2,000 limit. To help spread out-of-pocket prescription drug costs out over the year, starting in 2025, you can choose to join the Medicare Prescription Payment Plan. This is an option as part of your Medicare Part D plan that makes it easier to afford your medications with smaller monthly payments spread out over the entire year until you reach the $2,000 out-of-pocket maximum owed, instead of potentially having very high copays or coinsurance amounts owed at the beginning of the year. Switching to Medicare Advantage. If you switch to a Medicare Advantage plan, these plans have networks of doctors within each plan option. So make sure your doctors will be covered in-network by the Medicare Advantage plan you choose. You will also want to make sure all your medications are on the list of drugs covered by your Medicare Advantage plan. The list of drugs that are covered is called the formulary. Not all doctors will be in-network, and not all drugs will be on the formulary. Switching to traditional Medicare, premium penalty. If you switch from a Medicare Advantage plan to traditional Medicare, you should make sure to sign up for both Medicare Part B coverage and a Part D prescription drug plan, or you will have to pay a penalty on your Medicare Part B and Medicare Part D monthly premiums forever. Premiums are the amount you pay each month to have insurance. Also, know that Medicare Part B has coinsurance, meaning you will pay 20% of the cost for every doctor or care visit. Switching to traditional Medicare, Medigap, and medical history. Because paying 20% each time can add up, many people with traditional Medicare buy Medigap or supplemental insurance to help cover the coinsurance and copayments that Part B doesn't pay for. But again, be careful. If you switch from a Medicare Advantage plan to traditional Medicare, the Medigap plan will look at your medical history and can use it against you. This means your past and current health problems could affect how much you pay for Medigap, or you may be denied enrollment or coverage of some services in a Medigap or supplemental plan. In closing, Medicare coverage can be complicated, and there are new aspects to it in 2025 that you should be aware of to ensure you fully benefit. But there are resources available to help. Check out the Medicare Plan Finder at medicare.gov or reach out to your state health insurance assistance program at shiphelp.org. That's shiphelp.org to help you get the information you need to make the Medicare choices to best meet your medical needs.